Welcome to Another Thing. I'm Larry Menti. The CDC says the Zika virus is coming. The virus has been linked to horrible birth defects and brain damage. So how much of a concern is the Zika virus in our area? And what are our local and state governments doing to get ready for a potential outbreak? We begin our coverage in Philadelphia with Ellen Kaloje. Ellen.
Thank you, Larry. Right now, there is no vaccine to prevent the Zika virus, but one small pharmaceutical company right here in Pennsylvania is the first company in the world to be close to manufacturing one.
What's exciting for us here is with Zika is that, we were the first to develop a vaccine. We were the first to do animal studies, preclinical testing. We are getting ready to go into human clinical trials.
Dr. Niranjan Sardesai is the Chief Operating Officer for Inovio, a company with 200 employees based in Bluebell, PA, on the cusp of developing the world's first Zika vaccine, something millions of people around the globe are waiting for.
People are looking at Inovio is that, we've surprised a lot of people by our ability to move quickly and in response to new and emerging diseases.
The new vaccine won't be on the market for months. So in the meantime, the Centers for Disease Control is urging people to take common sense precautions to avoid getting mosquito bites and stop the spread of the Zika virus.
The most effective way to prevent the infection is to practice strict personal preventive measures that include using insect repellents and wearing long-sleeve shirts and long pants.
Also, stay inside in the air conditioning when you can, and make sure you empty all containers outside with any standing water, because that's where a lot of mosquitoes breed.
Zika is front and center for everybody, so there is a lot of attention on Zika, and we are well positioned to use our technology to make an impact on the disease.
Now, if you'd like a full detailed list of tips on how to prevent getting the Zika virus, just go to the CDC website, and that's cdc.gov/Zika prevention. Reporting for Another Thing, I'm Ellen Kaloje.
All right, thank you, Ellen. To talk more about Zika and the threat to our area, Professor Randy Gaugler is here. He's the director of the Rutgers Center for Vector Biology and a member of the New York City Zika Task Force. And a question jumps off, an obvious question jumps off my head, and that is the New York City Task Force? How come you're not a member of the New Jersey Task Force?
Well, New Jersey doesn't have a task force yet that I'm aware of. Just haven't pulled it together yet that way.
Are they doing enough in New Jersey?
Well, they're doing some things. They're doing a good job getting information from the health department to practitioners. But we haven't really pulled things together in a concerted way just yet.
Is it getting late for that?
Well, the mosquitoes are out now.
So
the viruses are here. There are 550 cases of Zika in the U.S. The mosquitoes are here. The viruses are here. So,
what is that when you look at the CDC map? Down south in Florida and along the Gulf Coast and in Texas, Puerto Rico especially, it's bright red. That's where the real threat is. Up here, doesn't seem so much.
Yeah, those are high-risk areas because the mosquito that transmits the virus is Aedes aegypti, the yellow fever mosquito. It's very efficient in transmitting that and other viruses. Here and the rest of the Northeast and other areas that you see with not red, those are lower-risk areas where the mosquito that transmits the virus is the Asian tiger mosquito, Aedes albopictus. It's less efficient at transmitting the virus. You see, the yellow fever mosquito prefers to bite humans. They're like roaches. They're highly adapted to the domestic environment. Albopictus is also highly adapted to the domestic environment, an urban mosquito, but it feeds on, it's more Catholic in its taste. It bites humans, but it bites dogs, cats, just about anything else as well, as long as it's a mammal.
How did this happen? I mean, we didn't hear about Zika, and all of a sudden it was the #1 health concern.
Isn't that? It's a very interesting story. A story starts in 1947 in the Zika forest in Uganda, where they were looking for yellow fever viruses, and they found a new virus in a monkey, and it was the Zika virus. The next year they found it in mosquitoes. Didn't find any humans till 1952. Between 1952 and 2007, there were only 14 confirmed cases of the virus. Nobody was concerned. A very obscure virus because it wasn't a public health threat, because 4 out of 5 people don't even have symptoms. And those that do at that time were very mild: fever, conjunctivitis, not a big thing.
I was told most people don't even know they have it.
That's correct. Most people, 80% of people have no symptoms whatsoever. Most of the other 20% have very mild reaction.
Which is kind of scary. If you can pass it sexually, then somebody could not know they have it and pass it to someone else.
Yeah, that's correct. And the sexual transmission is also very interesting. That's a very weird thing for a virus. Very strange thing.
I interrupted you, and you were getting just to where we are now. So how the big outbreak?
2007, there was a larger outbreak in a very remote island called the Yap Island in Micronesia. About a dozen cases, maybe 2 dozen. Still not a big thing, nobody really cared, very obscure. Then in 2013, there was a much bigger outbreak in French Polynesia. And now people were more concerned because they began to see a possible link to a nervous disorder called Guillain-Barré, which causes temporary paralysis. The virus is attacking the nerves. But still, most people hadn't heard about it. Then 22 years later, in 2015, it erupts in Brazil. And in 12 months, we have 1.5 million cases. And they noticed for the first time that it's not just mild symptoms, but there's an increase, 20-fold increase in microcephalic babies. And also now we're seeing other things as well, impairment of infant hearing, of infant eyes, brain damage. Birth defects are really a severe issue here. Even in this case, there's only 1% of pregnant women that have Zika virus do have birth defects, so still quite low. And deaths, extremely rare.
I keep hearing the symptoms downplayed. I keep hearing most people don't even get symptoms. It's very difficult. It doesn't stay in your system that long. It's difficult to pass along. So you keep hearing all of the downplaying of symptoms, and yet the reaction has been enormous. Why the disparity?
Microcephalic babies in the newspapers? Most of us. Go ahead.
But even though the numbers are so low, it's just that threat, even with 1% of the women that get it.
4,000 babies, microcephalic babies in Brazil, 4,000 that are going to require care for the rest of their lives. It's devastating for the families.
If we're left to our own devices, how can we fight the virus?
Well, the first line of defense is personal protection. Wearing repellents, particularly those that have DEET, because DEET is long-lasting. It's been around since the 40s. It's very safe. Long sleeves, long pants, keep your windows closed. If you don't have screens, use air conditioning. And then protect your environment. These are mosquitoes that are called container mosquitoes. They like to breed in stagnant water in your backyards, toys that collect water, bird baths, plant saucers, gutters, the corrugated pipes, the extension tubes, they love those. If you can go out once a week and eliminate that standing water, you'll have a big impact. And then avoid travel to high-risk areas like Central and South America. I told you earlier that I canceled my vacation in El Salvador for that reason. And the last line of defense, really, the big one is, in New Jersey, for example, we have 21 counties. Each county has a mosquito control unit. You can call them on the phone, and they will come and survey your area, and they will spray if necessary.
Brazil has been ground zero for this, as you mentioned, and they have the Olympics coming up this summer. There's been some calls to cancel and/or postpone the Olympics, and we both agree that's probably not going to happen. Is it wise to travel down there, though?
To Brazil, I don't recommend. To
go to the games?
I don't recommend going to the games if you're a young woman. No. If you're a male and go down, I recommend when you return that you practice safe sex for several months.
And that'll do it. It stays in men longer, is that right?
It stays in semen longer, at least. It's in, they find it in saliva, you find it in urine, you find it in semen. It just seems to survive longer in some areas than others. Usually the body clears it out within 1 to 2 weeks, but let's be safe.
Well, this show broadcast in Delaware and Pennsylvania, parts of Connecticut, New York, and New Jersey. Is there any doubt in your mind that there's going to be a cluster of outbreaks in those states?
Oh yeah, I think we will see we're not going to see anything 1.5 million cases like Brazil has. There's no possible way. They don't have the mosquito control that we have, and we don't have the efficient vector that they have. Will we see cases of Zika? Absolutely. Small clusters. I think the risk is low, but you're going to see some.
The CDC has come out and said that they are disappointed with Congress, and they don't usually get political, but they said they're disappointed with Congress because they need money right now, and there's a political game going on between Congress and the president. What would that money be used for?
It would be there to, a part of it would be there for vaccines. A lot of it would go to local mosquito abatement districts that I talked about earlier. Look at Broward County. They've already got 10 times as many requests for spraying as they had last year at this time. Where is the money going to come to accommodate all of that? It was supposed to come from Congress. Now we're not so sure.
You know, we were talking about Brazil, but a trip to Florida might not be wise. A trip to New Orleans might not be wise. They're the areas that would get hit. And without this money, how bad could it be?
It's hard to say. No one really knows. We really don't have a good handle on it. But again, nothing like we're seeing elsewhere. We do have very good mosquito control in this country. Most people have screens, which they don't have in Brazil. Most people have air conditioning, which they don't have there. So it's going to be a different ballgame.
So it won't be the same type of outbreak, but as you pointed out, it is such a horrible symptom that affects fetuses and babies that you get a few cases, and that's going to be bad enough.
I think pictures of a local microcephalic baby in the New York City press, I think is going to have a big impact on Congress.
And when you say microcephalic, just so we can point out what it is, it's a small brain.
Small head and small brain, yes. And it's a birth defect. These are retarded children.
Thank you so much, sir. My pleasure. I appreciate you coming in. I hope New Jersey gets a task force and they make you a member of it very soon. Professor Randy Gaugler, director of Rutgers Center for Vector Biology, and a member of the New York City Zika Task Force. We talked a little bit about travel. We will talk more about that. Traveling to areas where they have the Zika virus, is it advisable, and how is it affecting travel plans when another thing continues?